first, let's go bring in our good friend, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe. How are you?
Hey, Ray, how are you?
I'm doing terrific this morning.
Happy Thanksgiving to your family.
Same to you and your herd.
Thank you. I'm looking so forward to everybody being home this week.
I was just going to say, are they all coming in?
Yep, we're going to have everybody by the end of the week.
Now how big of a bird are you getting?
Oh, my gosh, 2 birds. 2 of them. Over 50. My wife is a saint. You know that.
Yeah.
Oh, my gosh. Over 50 people and 2 turkeys it takes.
It sounds like a great time. Actually.
It's great.
It sounds fun. Hey, what do you have for us today?
I wanted to talk because this has become kind of an area that there's a lot of confusion. It used to seem like it was pretty straightforward. Probably the most common surgical sports medicine injury that we see, and it continues to kind of increase, and you see it in all the high schools as well as colleges and professional ranks, is the ACL injury, right?
Yeah.
And so, we take care of a lot of high schools, and typically in a high school throughout a sports year, there can be 4 to 8. We've even got a few schools getting up near 10 or double-digit ACLs in a year. And once you head down that road, it doesn't really heal on its own, so we need to talk about surgery. And we thought it was a slam dunk the last 25 or 30 years that, hey, this reconstructive surgery is so good, and people do well after. Everybody knows it takes 9, we're really talking more 12 months now to get better. But one thing that's changed in the last 5 or 7 years a lot, Ray, is people are using different grafts to make the new reconstructed ligament, and that's confusing to a few people. So if it's in a family where there's a torn ACL and they start to ask, we live in a town, gosh, our orthopedic care here is so good, and there's so many good surgeons that do ACL reconstruction in our town, 5, 10, 15 that do a lot of athletes, and so we have a lot of choices. But they also use a lot of different grafts, and it's a little confusing. So the standby about 25 years ago was they would take and make the new ligament from the tendon below the kneecap called the patellar tendon. And they had a pretty good run with patellar tendon. That when they'd look at things down the road, the re-tear rate, re-tearing it wasn't bad. The side effects or complications, not bad. But really, it did start to have a lot of people that would have patellofemoral kneecap symptoms, particularly jumping sports, female athletes. Gosh, there were a lot of people that would have pretty significant, persistent pain in their kneecap and around the kneecap because we took a big part of that shock-absorbing tendon to make the new graft. So people started to go to the hamstring 10 or 15 years ago and make a graft out of the hamstring. Well, a couple problems with the hamstring, it stretches out, and some people, their graft, when they get the hamstring and harvest it, it isn't big enough, and it's the magic size is less than 7 millimeters, then they have to augment it with something else, and that kind of adds to the surgery. So recently, in the last 5 years, people started to use more the quad tendon, which is the big broad tendon above the kneecap. And so a lot of people now like to use the quad tendon. And of all things, in the last few years, some very good surgeons in our town have gone back to what's called a primary repair, where they sew the ACL back together, depending on what it looks like, and they wrap it in one of these biologicals like PRP that you hear about to make the graft stronger. And they, and say less side effects. Is the tear rate very high? Well, my answer to everything is more research in the next 5 or 10 years will tell us. But if your kid has a torn ACL, or your athlete is a coach, or somebody with one, you may be offered any of these 4 primary grafts that they start with. And it is a little bit confusing for parents and others. And part of it has to do with what kind of effects afterwards, what's the surgeon best at, what are they most comfortable with. And it will take and require a long talk with the sports surgeon to decide which graft is best.
Joe, in regards to the knee tears and strains and everything, any research backing up the field turf, does that have a role in this at all?
Nope, those never really, that so much more playing on turf. And by this time of the year, I'm a dinosaur to remember when kids would play, the fields would be torn up, we'd be on a muddy field and slipping around a lot. When they looked at the difference between the wet fields, the potholes in the field, the unplayable fields versus playing on the very sure but almost kind of over gripping of the artificial surfaces, never really did any studies. They were on both sides of it, Ray, and there were several good studies. Never never really showed that the newer turfs were any worse on the knee.
Interesting. All right, Joe. Well, listen, great stuff this morning. Enjoy your Thanksgiving with the family.
We sure will, Ray. Of course we will, and you too.
Okay.
And we'll talk again next week.
You got it, my friend.
Okay.
Thanks, Joe.
Take care.
Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, joining us live this morning.